Hello, everybody. Good afternoon. Thank you for being here with us today. I'm just going to give a few minutes to the people who are joining. Say about 3:05, 3:06, we will start proper. Happy New Year to everybody, since this is the first time that we're meeting this year. And thank you to our wonderful speakers for coming way before time. Thank you very much, everybody. Let's just hold on for some 5 minutes. Okay, I think we can start now. Good afternoon, everybody, and welcome to our first webinar for the year of 2025. I'll say a very big thank you to everybody that had joined us in 2024, and for everybody that is just joining us now in 2025, thank you very much. I know that we do not have a lot of people on the call right now, but as is our culture in Nigeria, people will join later on. It's an African time thing, but we have to be very considerate of people's time. So we're going to start. This session is going to be recorded, so you can access it, or any other person can access it on all our social media platforms. That said, my name is Farida Abdullahi. I am a legal practitioner and I am a member of the MedLaw Hub. This webinar is organized by the MedLaw Hub, and the MedLaw Hub is a virtual think tank that, has a lot of experts in the legal, medical fields. We have a lot of researchers. It's just a think tank for professionals in these fields to come together and, deliberate and talk about issues that affect the medical or the health sector. The Hub is all about advisory, is all about advocacy and training on medical law. Now, going to the topic of discussion today, we're going to be talking about navigating legal and management challenges in healthcare. And to do that, we have two distinguished experts to speak to us on this topic. They're going to tell us what these challenges are and how we can navigate them. I'm just going to put our speaker's profile. I'm going to share my screen now and put our speaker's profile. I hope everybody can see my screen. Great. So our first speaker for today is Dr. Osinachi Onyeoziri. I hope I'm pronouncing it well. He is a dynamic and result-driven healthcare leader with over 16 years of experience across diverse sectors, managing complex health programs and driving operational excellence. He's a seasoned Cuban-trained medical doctor with a proven track record in program and project management, business management, policy development and advocacy, and stakeholder engagement. He has successfully overseen large and complex health initiatives and developed innovative solutions that enhance healthcare delivery and foster measurable impact. As a strategic thinker, visionary, and business manager, Dr. Onyeoziri has led and managed across cross-functional teams, strengthened healthcare systems, built partnerships across government, private, and NGO sectors, and leveraged data and technology to create value, empower teams, and inspire transformation in healthcare and business environments. With his vast experience across different sectors, including the public, government, private, commercial, healthcare financing and insurance, and the social development, he brings a global perspective, blended expertise, information, leadership knowledge, and business insights to this discussion. And I'm very, very sure that the good doctor is going to do justice to this topic. He's a doctor and he's a management person. So he's going to do justice to this topic as it pertains to navigating management challenges in healthcare. Our next speaker is Mr. Damilare Adeoye Esq. He's a distinguished medical lawyer and founder of the Medical Law Hub, an initiative committed to advancing discourse on healthcare in Nigeria and beyond. With a unique blend of expertise in law and human resources, Dami brings a comprehensive approach to tackling complex issues in the healthcare sector, focusing on the intersections of law, ethics, and patients' rights. As a seasoned legal professional of over a decade experience, Dami has dedicated his career to navigating the intricate challenges of medical law, healthcare compliance, and human rights advocacy. His work with Medical Law Hub serves as a vital platform for educating both legal and healthcare professionals, fostering a deeper understanding of the legal frameworks governing healthcare in Nigeria. In addition to his work in medical law, Dami is also the Southwest Coordinator for the Human Rights Defenders Association, where he actively advocates for justice, equity, and the protection of human rights. This role underscores his commitment to shaping a just society and supporting the rights of vulnerable populations. Dami's professional background is further complemented by a distinction in human resources management from the IBAT College, Dublin, equipping him with advanced skills in people management, dispute resolution, and organizational dynamics. His expertise allows him to address critical issues in healthcare settings, from compliance with regulatory standards to managing complex team dynamics. Through speaking engagements, research, and leadership, Dami continues to make significant contributions to medical law in Nigeria. His dedication to ethical healthcare practices, combined with his strategic insights into the legal landscape, positions him as a thought leader in the field, passionate about creating positive change and inspiring the best practices in healthcare and legal circles. Thank you very much for being here with us today. Thank you to both our speakers for taking time out of their busy schedules to be here with us. And also thank you to everybody who has joined and joined on time, because that's very, very important. Without wasting much of our time, we'll go straight to our first speaker, Dr. Osinachi Onyeoziri. I'm just going to put up his slides now, and Doctor, please, you can unmute yourself and start, but I'll put up your slides right away.
Right. Thank you, Farida. I hope you can hear me very well.
Yes, very well. I hope every other
right.
person can hear you too.
All right. Thank you so much. And of course, it's a pleasure to, be among, a conglomerate of well-taught and knowledgeable people, because I know everybody here are thought leaders in their own fields. And I'm just here to facilitate the discussion and, of course, share my own experience as well. And then, of course, we can take it up from there. I mean, we are here to pick up a few things that we can apply and see how we can move, the health sector forward. Just like the topic says, navigating management challenges in healthcare. I know that this topic is not a new topic for so many of us. I mean, we've come across different discussions all around challenges in healthcare, and of course, which we know are numerous and they are large. But of course, we have to find a way around that and see how we can start tackling each and every one of them, as we move on. Okay, next slide, please. All right, so I mean, the key sections we are going to discuss today is all around, the roles of healthcare management. But before then, just a very brief background, which we all know. And then we'll look at challenges that are faced by healthcare managers and leaders. We'll also look at the opportunities that exist so far for healthcare improvement and, of course, transformation. We'll look at how to foster cross-sector partnership. We'll also look at ways to leverage data and technology to transform the healthcare sector. We also look at some innovations, just look at them briefly, but there are numerous, innovations, short-scale enterprises, startups that are trying to, find a way to improve healthcare delivery and the healthcare system in Nigeria and in Africa as a whole. And then, of course, practical strategies and approaches for healthcare leadership, how you can improve the healthcare management, the healthcare space, can improve your business. And then, of course, just the conclusion. Next slide. Well, of course, I think I will just move over this. I mean, I've been introduced. All I can say is that I'm a father of 3 wonderful children who are my, motivation for, trying to ensure that the healthcare system is improved, because I'm looking at their future. So I believe that is also a motivation for a lot of us. Next slide. All right, so a brief context to our discussion. We all know, healthcare is a global issue. When we talk of challenges in healthcare, we're not just talking about challenges, within our country, Nigeria, or within Africa, but of course, healthcare challenges is a global issue. Certain challenges, which we see here, are also seen across all other countries in the Western world. So one key thing that comes into mind when we are talking of the global economy is this level of increment, level of increase, in different populations, categories. And even though in Africa or in Nigeria, to be precise, the population more or less, we have a certain younger age population that are growing faster than the aging population. But globally, there is a growth of the aging population, and that is an issue. I mean, when we're talking of healthcare, because the advance, your age, the higher probability for you to get or find yourself facing healthcare challenges or healthcare issues, as the case may be. So the level of advancement in the population of people that are in the advanced age, I mean, is growing rapidly globally, and that poses a healthcare challenge. And of course, we all know the rising chronic disease trends and re-emergent diseases that are coming up. We know that among the top 10 causes of global deaths, most of them are chronic diseases. And then, of course, there are resource constraints, not only in Nigeria, but globally. When you go even to the Western world, they have their challenges in terms of resources because the population is growing, things are coming up. So the resources are not so sufficient, to be posed on healthcare alone. There are other things that need resources. So there is a resource constraint globally. And then coming to the African context, like I said, the population is growing rapidly. I mean, Nigeria, 10 years ago, the population we had was not what we have today. We are over 200 million in population. So there's a rapid population growth, which also is an issue for healthcare, because the more the population grows, the more the healthcare burden grows. And then there is urban migration. I mean, everybody's looking for greener pastures. I mean, the urban areas are more developed and more advanced. So there is a migration from the rural area to the urban area. And of course, our infrastructure is inadequate. We all know, we can testify to that. I mean, it's not a new thing, it's obvious. You can see that our infrastructure is inadequate. And of course, low healthcare funding. You know that the Abuja declaration of 15% of the total budget at the moment I can tell you just a few countries in Africa have actually attained that. Nigeria is not among them. Nigeria is still at 5% of the total budget. And of course, that is low compared to what is required to be able to tackle the global issues. Next slide. Well, one thing that we also need to understand, especially as a healthcare manager, is that you are in a position where you have some critical responsibility, I mean, that you have to take very seriously. And the critical roles of a healthcare manager is not just looking at health alone. We know that there are several factors that determine health by WHO definition. Healthcare is what? Is a state of well-being. You have to look at the physical environment. You have to look at, the social environment. You have to look at the behavioral environment or the mental environment. All these things contribute to health. So as a healthcare manager, you are looking at these different factors because they are going to influence your ability to manage healthcare because all those factors contribute to health. So this is just what I want to point out here. There are different critical roles that a healthcare manager, takes up, from strategic direction to ensuring that there is healthcare access, ensuring, of course, that all the stakeholders are, involved in the planning and other things. But what I want us to understand that in as much as your main focus is on ensuring that there is accessible healthcare, and what we mean by accessible healthcare is that the healthcare is affordable, is available, is timely, and is well acceptable standard. There is a minimum standard that is required for it to be acceptable. So you have to ensure that, but at the same time, you have to make sure that all other factors that contribute to health, that you are taking care of them. Next slide. Yep. This brings us to the main, point of our discussion, the challenges of healthcare management. Like I said in my initial introduction, I said healthcare is a global issue and challenges are numerous. There are many challenges, in fact, beyond what I have here, but I just want to point out a few of them, which we can look at. Of course, these are areas that we can start to see how we can start managing or addressing them. And one critical challenge that is faced by healthcare managers all across the globe is infrastructural deficits. So the infrastructure, especially in Africa, our infrastructural structure is deficient. It's not inadequate to handle all the challenges we have. From inadequate facilities, I mean, in Nigeria, we have a population of 200 million. And of course, we have a primary healthcare centers that are close to 34,000. But among all this, it's only about 20 to 25% are fully functional. So, I mean, that shows how critical this is. So our infrastructure is deficient, and that is a critical challenge for a healthcare manager. Then, of course, our poor maintenance culture is something not to be written home about. I mean, something that is beyond just, talking about it. We have a very poor maintenance culture, and that affects even the little infrastructure we have. When you go to different, especially the rural areas, you will see a lot of health centers that have been left, dilapidated. They are in worse condition. In fact, even an animal would not even want to stay in there. So that is as a result of poor maintenance culture. Then, of course, we can talk about resources. I mean, there are different resources, from financial resources to human resources to material resources. They are all inadequate. I mean, we don't have enough resources to handle, the challenges we have. In terms of finance, of course, I talked about the budget allocation to health, which is, below what is required. There is also, for healthcare managers, they are not able to access credit facilities or loans. And this is as a result of certain issues that needs to be tackled. And one of them is most healthcare facilities lack the financial expertise. They don't have adequate financial management expertise. I had a discussion with a couple of, financial institutions during a program that I, was handling. And one of the things they mentioned is that a lot of healthcare facilities do not keep appropriate book or financial books for their business. And that is a no-no for most financial institutions. And of course, for you to be able to access loans, you need to keep your books in order. You have to have appropriate and adequate bookkeeping. And that is something that most health managers need to look into. And of course, we talk about shortage of skilled professionals. You hear every day people are migrating. I mean, the brain drain that's happening, which I said that the number of doctors we have in Nigeria is not even enough to tackle or take care of the population. And now people are also moving. So you can see how critical this is. Shortage of professionals. Then, of course, insufficient supply and so on. Supply chain is inefficient. The procurement process is very poor. All those things, help to even worsen the constrained resources that we have. We talked about governance issues. I mean, leadership. There are a lot of healthcare leaders that do not have the adequate skills to even manage the healthcare system. So there is weak leadership skills, there's weak management skills. The accountability and transparency in healthcare sector is very poor, it's very low. And that alone has affected even the trust most people have in Nigerian or African healthcare system, because they lack accountability. There is no transparency. So this is also another challenge that we need to also look into very seriously. Corruption and funds management, or mismanagement, sorry, is something, of course, that has been in discussion all this while. So I don't want to too much buttress on that. And then we talked about regulatory and policy issues. I mean, some of these are also legal challenges, which I know that my co-partner or co-speaker is going to talk about. When you talk about regulatory issues, there are a lot of things we look into, from licensing and processing of your registrations to complex and inconsistent policies that guide, the processes in healthcare system, to many things. So, I mean, this is also a challenge. The regulatory system or structure in Nigeria is overburdened. Let me use that word, because there is no efficient process. They are using, most of the regulatory agencies are still using paper system. And paper system, no, is not efficient. And of course, this is a challenge because it creates administrative burden. All right. We talk about technology as well. Technology, we know that is a vehicle, a viable vehicle to make processes more efficient. But in the healthcare sector, there is low adoption of technology. There is also low use of information systems. And these are, vehicles or tools that can improve the processes in the healthcare system. We also talk about limited IC technology of most healthcare workers. And then we talk about lack of data use. I mean, some healthcare facilities, they have data, but they don't use data in decision making. They don't use it, at least because data is a viable information, is a viable tool that you can use to improve the healthcare system. And when you don't use data, of course, that becomes an issue. You have a available data within your reach, and then you are not using them. I mean, that is a problem. And we cannot improve the healthcare system without data, right? We talk about operational inefficiencies. This is something that has been in ages, from bureaucratic processes to interference by political parties or bodies, to poor collaboration between different sectors. Even within a facility, there is no collaboration between the departments. And that is wrong. That is a challenge, because without collaboration, without coordination, you cannot be able to move forward from where you are. Next slide, please. Then we talk about disparity in healthcare access. I know I talked about urban migration. That alone has affected even the healthcare accessibility for people, especially in the rural areas, because most of the professionals are now migrating to the urban areas. And that is also a challenge for most healthcare managers. There is this geographical disparity and, of course, financial barriers, especially for people in the rural area, because we know that these people are of the low, socioeconomic class. And so they cannot be able to afford some of these services, right? And that is also a challenge. Then ethical and legal challenge, of course, we have experts who are going to talk about the legal aspect of it, but this is also a challenge for most healthcare managers and leaders. And then, of course, the disease burden. We know we've here today, this disease has come up. Cholera is on the rise. Of course, some years ago, we talked about Ebola. And then here we're also talking about non-communicable disease, chronic diseases. Cancer, for example, cancer is on the increase. Cancer is among, the chronic diseases that is right now, of so much burden to a lot of people. Okay. And there's, of course, surveillance for these diseases is poor, especially in Africa. And that is a challenge. Then we talk about crisis and disaster management. I can bet you, if you look at all the facilities, healthcare facilities we have in Nigeria, I mean, 9 out of 10 of them are not prepared for crisis and disaster management. And that is a challenge, because crisis can come up at any time, disaster can come up at any time. And if you don't have the capacity to manage it, of course, that brings so much burden. It brings so much issue. It will affect even your own normal processes. So the ability to manage disasters, manage crisis is lacking, especially in most African nations or African facilities. And then we've talked about sustainability. Sustainability is something we have to also put into consideration, because a lot of policies that we come up with, especially from the governance perspective, we talk about implementation, but one key thing lacks, which is sustainability. And sustainability is something that will take the impact of whatever we create beyond, that immediate environment or that immediate discussion. So sustainability is a challenge for most healthcare managers. They come up with initiatives, but they don't know how to sustain those initiatives. That is a problem. And most of this is as a result of both misinformation, is as a result of distrust in the system. I talked about how lack of transparency and accountability has created distrust in the system. And when you don't trust the system, of course, you will not be able to participate. There will not be in community involvement, right? Okay, next slide, please. I had to take time at least for us to understand some of these challenges, even though we've been hearing about challenges. All right, what are the opportunities that exist right now for healthcare? I know we've been hearing over the news, right from the takeover of administration by this current administration. I mean, the agenda, the HOPE agenda, and right now, of course, the health sector renewal agenda. So we talked about how, this current administration is focused on improving primary health care in Nigeria. Yes, government is doing their part, definitely, but we have to also play our part. But of course, that government's own part is creating opportunities for us or the private sector to now get involved. And one area that is very necessary is preventive healthcare. Okay, so there is increasing investment in primary healthcare, and that has created an opportunity for us to invest or for us to focus on preventive healthcare, because a lot of these healthcare challenges that we are seeing today, if we're able to, improve the preventive area of healthcare, we'll be able to tackle diseases seamlessly, right? So there's an opportunity for us to increase our investment in primary care. Secondly, of course, expanding other areas of prevention like the immunization, like healthcare education programs. All these are opportunities that exist, especially with the current administration's agenda on health. And then the local manufacturing and logistics of medical products. Yes, we have an opportunity right now to invest in local manufacturing. I know we must have heard of the presidential initiative on unlocking the healthcare value chain. Okay, these are initiatives that the current administration has put in place to improve the environment for local manufacturing. And that is an opportunity for private sector, an opportunity for people who are interested, in the healthcare system or improving healthcare system to venture into local manufacturing, venture into logistics, venture into, cold chain business, venture into the value chain of healthcare. Okay. And that is something I also would advise a lot of people that are here listening to me today, that this is an area, an opportunity that exists so far with the current administration. Okay. Next slide. Then we talk about technology, emerging technologies. I mean, like I said, one of the challenges in the healthcare system or healthcare sector is the low adoption. Okay, and this low adoption makes a way or opportunity for more people to adopt technology. So there's an opportunity to leverage technology to improve healthcare delivery system, to leverage technology to improve health education, to leverage technology to improve diagnosis, okay, or diagnostic procedures, to improve other areas of the healthcare system, right? So we have telemedicine, which is more about consultations, medical consultation, remote consultations, virtual consultations, virtual diagnosis, virtual management of cases, mobile health solutions that help different areas of the healthcare system. We talk about the AI, which is artificial intelligence and machine learning. These are technology that can help, especially in diagnosis. They can help even in detecting, diseases even before they, show themselves or before they manifest. Okay, what we call precision medicine, right? We also talk about digitization of healthcare management processes like regulation, okay, like quality, a whole lot of them. So you can leverage technology. There's opportunity to leverage technology right now to improve all these areas of the healthcare system. Then there's opportunity for collaboration, okay? The current administration is also particular about collaboration and partnership, okay? So that has created an opportunity to collaborate with different sectors, with different organizations, private organizations, collaborate with the government as well, collaborate with even international partners, all right? And bring up solutions or bring up initiatives that can help move the healthcare system forward. We talk about strengthening public-private partnerships. There are existing public-private partnerships that need to be strengthened. And of course, more public-private partnership initiatives can also, be embarked on, right? Next slide. Maybe while we're going to the next slide, we also know about the sector-wide approach
You
of the
understand?
coordinating minister.
Good.
Sorry,
Almost.
is there a question? Okay, all right. So I was talking about the sector-wide approach of the coordinating minister of health and social welfare, that generally of the Federal Ministry of Health and Social Welfare. I mean, this sector-wide approach looks at the 4 pillars, critical pillars. And among those 4 pillars, you can see that the private sector partnership is very needed. Is something that they have focused on in each of those 4 pillars. So that is an opportunity to collaborate with the public sector to see how healthcare can be improved. Now we talk about health financing, all right? Health insurance. In 2022, the National Health Insurance Authority Act was put in place, right? It was, I think, by President Buhari. He signed it into law, and that creates an opportunity for us to even venture in health insurance administration, because right now, health insurance has been made mandatory for every citizen and resident of the Federal Republic of Nigeria. So that is an opportunity to also venture into health insurance administration, strengthen health insurance administration, collaborate with health insurance administrators, and see how health insurance or health financing can be improved in the country. We talk about innovative health financing solutions. You can come up with other innovative health financing solutions, like the diaspora financing solutions, diaspora remittances. You can leverage those to improve, the financing of healthcare. Then we also have community-based solutions. The president's initiative on improving primary healthcare has centered on improving community-based initiatives. So there's opportunity to also venture into community-based initiatives. There's also this initiative to train so many health workers, okay? And most of these health workers are going to be in the communities. So that's also an opportunity for us to leverage and improve the healthcare system. You can come up with community-based solutions that you can leverage the health workers within the community to move, okay? Grassroots initiatives that can create awareness, that can, educate people around diseases, prevention, how to manage diseases, how to, in your house or administer home-based, management procedures. So these are all opportunities that exist. There are so many opportunities that exist within the health sector. But I think these are some of the areas I will touch on in this webinar. Next slide, please. I think I'll go a little bit faster so that I think we can have some time for more discussions. So how do you foster cross-sector partnership? Okay, one common thing, especially when you are dealing with partnerships or collaboration, is to identify your common goals. You cannot partner with an organization or a group of people who have different goals or who have different objectives from your own. So it's good to first of all identify your own common goals. What are the goals that are common for you? Okay, before you now take the initiative to enter into a partnership. Without this, I bet you that the partnership will not work. So collaborate on initiatives that are aligned with your own objectives. Secondly, you have to build trust and transparency. Very critical. I can tell you this because during the program, I manage a USAID program, okay? And during that program, we had to do what we call a landscaping. And one of the findings that we brought out was that there is a very high distrust and mistrust between the private sector and the public sector. And that has created a huge gap. So when there's a program, you don't see the private sector involving themselves because of the lack of trust. So for you to have a successful partnership, you have to build trust. And how do you build this trust? You have to establish clear communications. You have to, continuously and regularly communicate on what is happening with your partnership or with the programs that you people are collaborating on, right? And then, of course, mutual respect is critical for you to establish trust. Where there is no mutual respect, trust cannot come into existence. Then, second and thirdly, leverage resources and expertise. Look at your competitive advantage. I mean, what do you have advantage over the other partner? You bring it out, okay? So you have to share knowledge, share resources, all right? Technical knowledge on how you can move things forward, especially on what you are collaborating on. So if you have a strength, as an organization. Okay, you bring out that strength, and then or the other partner can also bring out their own strength, and then you collaborate on that. And of course, with that, you can continue to move forward, and that helps in strengthening your partnership. All right. And lastly, you have to develop what we call a sustainable partnership. And how do you do that? Whatever contract or agreement you are entering on, ensure that it's more of a long-term commitment that you are making. I can bet you that short-term commitments, cannot take you to the place of sustaining such partnership, because after the contract, after your collaboration or whatever initiative that you are collaborating on, other people moves on. I mean, all the different partners will move on. Okay. So, but when you have a long-term commitment, I mean, that helps to strengthen your partnership. And with that, you can enter into as many partnership as possible. You can enter into as many initiatives as possible. Okay. So you establish shared decision making, right? Let your decision making not be one-sided, right? Let there be a shared decision making, and let everybody be on board on whatever decision that needs to be taken. Okay. And then you have to evaluate your performance, your partnership outcomes regularly. Okay. And that should be done, collaboratively with your partner. All right. So with this, I bet you can be able to create a very strong partnership, cross-sector partnership. Right. Next slide, please. How do you leverage data tech and technology for healthcare transformation? I talked about leverage. I think when I was talking about challenges, I talked about lack of use of data for decision making, and that is a way to leverage data. Okay, data-driven decision making. It helps you to manage a lot of things in the healthcare system, especially talking about healthcare priorities. Your data can help you know which areas you have to put more resources or you have to put more focus on. Okay, it helps you to carry out surveillances of diseases. Okay, it helps you to track your progress. I mean, if you are improving the healthcare system and you're not tracking your progress, you will not know if you are moving forward or you are just at a steady place. So data helps you to track whatever thing you are doing. And of course, it also helps you to allocate resources. When we talk about telemedicine, I've talked about that, okay, when I was talking about, okay, the opportunities that exist. So you can use data for telemedicine to enhance healthcare access, especially in remote areas. It will also help of course, reducing delays. All right, delays in treatment. I know that delays is dangerous, especially when you're talking about health. So telemedicine can help to reduce that delay, because the person will start having, some form of management, okay, before even he gets physically to the facility. And then electronic health records. This is also another area where you can leverage data and technology to improve the healthcare system. Next slide. Artificial intelligence, I talked about this, okay? How you can use artificial intelligence to make diagnosis of diseases, to predict, okay? What we call predictive analytics for epidemics, okay? You can use it to determine, okay, this disease is it likely to cause an epidemic, and which areas are they likely to affect? So artificial intelligence can help you in predictive analytics. And of course, personalized medicine. I talked about precision medicine. It can help you to administer personalized medicine. Precision medicine is all about using the gene, what we call the genetic information, to make diagnosis of diseases, or using that to determine how the disease is progressing or how the management is progressing. And then, of course, cybersecurity and data privacy. This is another critical area, okay, especially in healthcare sector, where the information or personal information is very necessary to be protected. So cybersecurity and data privacy is another area, or how you can leverage technology, okay, to improve the healthcare system. Next slide. Some innovations, these are different innovations that are, so far existed in Africa, not only in Nigeria, all across Africa. So you can see a lot of them, telemedicine platforms. This is not all, this is just a few of them, but there are so many. Okay, when you look and search for them, you see a lot of them. But these innovations have been helping, to see how health sector can be improved, from creating, virtual tele consultations and telehealth, okay, platforms, from creating solutions that can help to improve different aspects of the healthcare system, from also helping in electronic medical records and hospital management system, improving the processes in the hospital. And of course, AI and ML, which I talked about a few minutes ago. So we have the 54 gene, which is a precision medicine organization. They used the genetic information to carry out diagnosis, carry out even management of diseases. So, and then Zipline is a logistic company that uses drone to, transfer or transport healthcare products. And of course, Baobab Health, which is also a very nice solution that makes use of AI and machine learning. Next slide. Then we also have logistic and medical supply chain solutions. You can see some of them. LiveBank, I know some of us know LiveBank. You also know Drugstock. Then we have diagnostics and specialist referral platforms. We have MDAS Global, Vula Medicare. And then there is also a solution which I'm aware of, which is called the mobile app for tuberculosis screening. That's an application that was developed by pharmacists in collaboration with the Institute of Human Virology. And this is an application that helps in the diagnosis of tuberculosis. So it's very, very, very good application and solution. So these are solutions that are helping to improve the healthcare system. We also have e-learning and digital health education platforms. At least that helps in educating people or educating the healthcare workforce, or help improve their knowledge and the ability to manage the healthcare system. They also have digital platform for healthcare regulations. Okay, these are platforms that help to regulate healthcare. Next slide. We have what we call the public-private partnership solutions. Okay, there is a solution or initiative that was also established, by pharmacists in collaboration with the Delta State government. That's an access to finance program, public-private partnership program, that help to improve the primary health centers that are non-functional in Delta State. So this initiative identified some of the PHCs that are dysfunctional, especially in remote areas. And through a public-private partnership, these private or primary health centers were revitalized, we are renovated, medical services were reactivated, and they started working optimally, all right? And then we also have quality platforms or quality assurance and quality improvement solutions, like the quality platform by SafeCare. And then we have micro health insurance as well. So these are different solutions in healthcare system that have been helping so far, okay, to improve healthcare delivery and healthcare management system, right? But there are opportunity to have a lot more, okay? These are just a few of them. There's more opportunity to venture into other aspects of the healthcare sector, which I will also advise or recommend for us to also start thinking towards it, because that's the way we can be able to push forward, the spin from where we are right now in healthcare to a higher level where we want to be, leveraging technology, right? Next slide. I think that is the last slide. Okay, so what are the practical strategies and approaches for healthcare leadership, right? You want to be a healthcare leader, or you're already a healthcare leader. How can you strengthen, your ability to manage, okay, the healthcare system? First of all, you have to strengthen your capacity to lead, right? Invest in leadership development and training programs, and then also build what we call a sustainability trend. There are people who are under you who have the ability to, to lead, or who have shown some sort of ability or some sort of skills in leadership. Try and look for what we call mentorship program for them, and groom them up, so that at the time you, who is the leader right now, is either moving apart or moving forward, those people can also take up that mantle, right? So while you are improving the leadership capacity for people that are already in leadership position, you also improving mentorship for people who are aspiring leaders or emerging leaders, as the case may be. Okay, that's the only way to strengthen, the ability to manage the healthcare system, and of course, sustainability in healthcare management. And then, secondly, you have to empower your health workers, your staff. You have to empower people that are working with you. Okay, accountability is critical in the healthcare sector. Transparency is critical. So create an environment that supports all this. Okay, for the healthcare workers, let there be performance-based initiatives that help to incentivize them. Okay, motivate them. Lack of motivation is one of the key things that were one of the challenges in human resources. And once you have all these incentives that motivates, that creates an environment where there is supportive teamwork, okay, you are empowering them. And of course, you are also helping to create an environment where there's accountability and transparency. So each person should be accountable for what he or she is tasked with, right? And of course, you audit all those, you carry out performance audits and reporting mechanism, reporting programs, right? Thirdly, community engagement is very, very important. When you are undergoing or undertaking an initiative or undertaking a program, a project, you have to involve the community. And that's the only way also you can ensure sustainability for that program, right? When you create community ownership, even when you are not there, the community moves it forward. So you have to involve the community in both planning, implementation, evaluation, okay, of the different programs or healthcare initiative that you are taking up to, right? And then ensure that the leaders of this community are in support of whatever initiative you are building. And then, of course, create a culture of continuous learning, right? You have to build that culture of continuous learning and adaptation, encourage research, okay? Encourage people to try new approaches, try new strategies, come up with new initiatives, come up with new solutions, okay? From the implementation of those solutions or initiatives, you pick up the learnings which you adapt, all right? Okay, that's the only way to ensure that you continue to move forward. That's the only way to ensure that healthcare is continuously pushing forward and being managed, okay, the way it's supposed to be, because, the world is evolving. Everything is evolving. And if you are not learning, if you are if you're an enterprise or an organization that does not innovate, okay, you'll be left behind. Okay, you'll still be managing or using the old method, which is no more in vogue or which is no more applicable. You still be trying to see how you can struggle with that because you are not learning, right? So in kind of build that culture, okay? Let there be an environment where there is innovation, right? Next slide. Then, of course, as a leader, you have to lead the process for continuous improvement. You cannot be on the sideline, whereas your people are the ones that you pushing improvement. You have to lead, okay, by example. You have to be actively participating in continuous improvement. And of course, you have to show commitment. And then, lastly, advocacy, okay? Right, while you are doing your own part, then of course, there should be a strong advocacy for policies changes, for policy implementation, okay, for strong institutionalization of the policies that have been, brought up, okay. Let there be an advocacy, and that advocacy cannot be done by you alone. You have to collaborate with like minds. You have to collaborate with other people that have the same agenda, that have the same focus, okay, and carry out advocacy, strong advocacy initiatives to ensure that the policy is also backing whatever you are doing, right? Okay, so I think that brings me back down to the last part of this discussion, which is what do I think? Okay, after talking about this, what do I think, right? If I ask you right now, from all the discussions, okay, or all what I have presented to you today, what do you think about healthcare management? Okay, how do you think or how do you feel that healthcare managers can be able to navigate some of these challenges or all of these challenges that we've talked about? Okay. This has been answered actually in the presentation, but I'm just trying to bring it forward. You have to ensure there is strong leadership. Okay. Creativity and innovation, very critical and very necessary, right? You have to be creative as a leader. You have to be creative as a manager. You have to be innovative. Collaboration and partnership, you cannot do it alone. You have to collaborate and you have to partner with people that can help you push forward whatever agenda or initiative that you want to, embark on. And then you have to leverage technology with data. Okay. Make sure that whatever data that is coming out is used in decisions. Okay. That is the only way you can be able to manage or address some of these challenges. There are opportunities to transform the healthcare system. We have seen that from the presentation. And then this is something that all we have to do together. We cannot do that solely by our own. We have to collaborate. We have to come together. All the different ecosystem partners, okay, needs to come together to address this issue, from the government to the private sector to civil society. And that is the only way we can push, the healthcare system forward. Thank you. I think that brings me to the end of my presentation, of course, and then I'll leave the floor for questions. Over to you, Farida.
Thank you very much. A whole lot was going on in my head while you were presenting, and it was a very straight to the point conversation. And you talked about the things that really, really mattered the most. Now, it's one thing to come to a webinar and learn. It's another thing to come to a webinar and start to think about, oh, so what can I do? How can I contribute? Because I can contribute. Because while you were talking, I don't know why these things didn't occur to me in the past, but I started thinking, oh, okay. It's more than just, I can say, okay, maybe I try in my own little bit in terms of advocacy and stuff, but beyond advocacy, what can I do? Can I sit down and think about these things, most especially when it comes to leveraging technology, right? Because I knew that there were a lot of health tech startups and a lot of people are doing fantastic things in the sector, but I was amazed to see so many. Honestly, I did not know that there would be so many people doing things. And it's so interesting to see that people have looked at the problems that there are or the challenges that there are in this sector and told themselves that, oh, this is what I'm going to do to make sure that I contribute my quota. I try to solve this challenge in this little way that I can. And it's amazing to see that these things compound and, they benefit the entire sector. You understand? So I'm very grateful for this eye-opening lecture. It's just made me want to go back and think and see. So what can I do? How can I contribute? Because it's more than just talking about it. It's about taking really active steps to make sure that, the challenges that we face are solved. And I like that you've given very practical solutions to these challenges. Thank you very much. I don't know if we have enough time on our hands to take some questions, but if there is enough time after our second speaker has presented, we'll definitely come back to our questions and answer segment. But before then, I would just like to remind everybody that our speaker's LinkedIn is on the chat. So you can go and you can reach out to him on LinkedIn if you have any questions, you need some clarification, and you just want to learn more. So I believe that he would respond. I know he's a very responsive person, so he'll respond to you. So without wasting much of our time, I want us to go into our second lecture. We've talked about management challenges, very important, because the people who run the healthcare centers, the hospitals, we need to, know the challenges they're facing and how they can solve that challenge. But very important and very intrinsic to this sector is what the law says and how the law can help. So we are going to go to our speaker who will be talking to us about the legal challenges. I'm just going to put up his slides now. And Mr. Adeoye, please, you can unmute yourself, but I'm just going to put up your slide now so we can go directly into the legal challenges. Thank you very much.
Thank you, Farida. Am I audible enough?
Very clearly. Can
Thank
hear
you
you.
very much. Thank you, Dr. Osinachi. That was brilliant. I must commend you for a good presentation. Uh, recently I took a study on management, human resource management, because I became curious to learn more about management in healthcare. And you listening to you just blew my mind and touched on the critical areas that when I was coming up with my presentation, I just knew that, and I hoped that you will touch on those things, and I'm happy that you did. And here I'm just going to be focusing on the legal aspects. You already said so many things that I know that people are curious to know, talking about advocacy, the policies, the legal challenges, and that will be my focus this afternoon. And very critical because well, a lot of time and some of the clients I've had in the past, they often don't know how important it is to understand the policy aspect, the legal aspect of health practice, healthcare system in Nigeria until there's a problem. And I always tell them that it's always better to know this before these challenges come up. And this is why it is critical to talk about this today. And I'm sure I have a very limited time, so I'm just going to dive into it and get into my presentation. Can I have the next slide, please? So there's a lot of things that we can talk about when it comes to healthcare management, especially in the legal aspects. And Dr. Osinachi has started well by making us understand that it's a challenge when it comes to the legal aspect, the policies, advocacy, and we can't stop talking about it. So these are just random legal side of it. There are much more than this that time will not allow me to go through all of them. So I did not bother to bombard us with all the legal jargons here. But it's important we know that we have the constitution, and the constitution is in the legal term, we call it the good norm, where if you cannot connect all the laws to the constitution, or if they are against the constitution, they are null and void. And this is why I always refer to the constitution when I'm speaking on anything legal, because that is the source of every law, or every law cannot contradict to the constitution. And then in 2014, we had the National Health Act, and thank God that we had a group of lawyers and healthcare providers, management, who felt that there was a need to have that framework in Nigeria. And that really helped because now, unlike before that, there was nothing to really rely on. This gave a fresh breath to the sector. And now we can say we have sort of a framework to work with. And then we have the Medical and Dental Practitioners Act, where, like in every sector in the health sector, every profession, whether it is nurses, whether we're talking about the doctors or other like scientists, they all have laws that is regulating them. So here I just mentioned one, which is the one that most people are aware of, are well will acknowledge that they know. So, which is the Medical and Dental Practitioners Act that regulates the affairs of doctors and medical professionals as a whole in Nigeria. So, going forward, we are going to be talking about more of the challenges because I have a limited time and want us to touch on the legal challenges that really affect healthcare management in Nigeria. But when we're talking about healthcare management, what essentially are we talking about? Because a lot of time we assume that we know these things. So I'm just going to briefly just give a definition that I have here, and then we can go full-fledged into the legal challenges that it's important we touch today. So healthcare management, it simply involves the administration, leadership, and governance of healthcare systems, ensuring efficient delivery of quality care, emphasis on quality care, not just any kind of care. So in Nigeria, healthcare managers face numerous legal challenges, either due to the fact that it is hard to even know if there are any legal provisions, like Dr. Osinachi rightly mentioned in his presentation that it's either we have legal framework or they are not there. For instance, in terms of surrogacy till date is still a discussion on the table. We still don't have a serious law that that addresses surrogacy in Nigeria. So this is a challenge. And as we go further, you will see how difficult it can be if nothing is done. So now to the challenges. Please can I have the next slide? So most important parts, especially when you're starting, is regulatory compliance and licensing. For instance, you want to have, you want to come up with a management, you want to have let's say, health institution in Nigeria. What do you need to know? What are the things you need to comply with? What are the licenses you need to get? Recently, a client got a client that, got in contact with me and wanted to know this thing. And it's important because without that, it will be illegal to even start anything. So it becomes a challenge for facilities and professionals to comply with numerous regulations, which can be very complex and burdensome. So this itself is something that needs to be addressed, and we cannot go further and say that, oh, they are there. In most countries, there's always a system that helps to align this, regulatory compliance processes. But in Nigeria, you have to go from A to B, from B back to A, and here and there. And it makes it very complex and cumbersome for most people who want to establish, or in managing healthcare facilities in Nigeria. So I just put here, and so what I've done is, because I know I'm limited with time, is, in every challenge, I'll put relevant law and the implication, or laws and the implication of not following following up to address the challenges. So here, we have the Medical and Dental Practitioners Act, like I mentioned earlier. Requires that medical practitioners must be licensed. You can't just practice without a license. And it just doesn't apply to medical practitioners as well. As nurses, before you can practice, you need your license. As scientists, before you can practice, you need your license. Every profession in the health sector requires a sort of license that you must have before you can practice. And it's cumbersome for healthcare managers, because now they need to deal with all of them individually and ensure that everything is in compliance with the law. And then we have the National Health Act that mandates healthcare facilities to meet up with minimum standards set by regulatory bodies. And by the way, these are just federal laws. Every state also have their own laws that must be complied with. So it's really cumbersome, and it's important that they still follow through. So what's the implication? Non-compliance can lead to fines. In fact, it's worse if there's no compliance, closure of facilities or loss of license. So for instance, if an healthcare facility is using a quack doctor, of course they will close it down, be in trouble. So this is really important. Next slide, please. Then this is more of a generic challenge, and I decided to put it because it's very important that we mention it, and that is that the standard of care cannot shift. It is always constant. So it becomes a challenge when, there's a malpractice in a facility. How do you go about it? We often talk about this is quite generic, quite common, and it falls under, in fact, most of the other challenges that I'll be addressing, because it's more like the malpractice. For instance, if you are a doctor in Nigeria and your license has expired, but you are still practicing without renewing your license, it's a form of malpractice. And that is why when there's any case with the Medical and Dental Tribunal in Nigeria, the first thing they want to know is that you are practicing with a current updated license. So this is a challenge that healthcare managers must address and ensure that they constantly check and ensure that they are up to date. So of course, there's a criminal aspect of negligence. And it's so dangerous, like the example I cited, that if negligence is committed by a medical practitioner, for instance, it has been established and it is confirmed that the person is not licensed, it comes under Section 343 of the Criminal Code Act, which it's a criminal offense. It's even worse. It's more like an individual who is not a doctor operating on a patient. That is how it's going to be treated, and it is worse. So, of course, on the management, it's going to be there'll be a significant financial loss. And in Nigeria, there's a lot of management authorized hospitals that try to hide these things, and it makes it even worse. They want to hide it because they know that, you have a doctor, for instance, that is not licensed, you know that there's a malpractice case in the hospital, but you're protecting the person. Eventually, it comes out and it even blows out of proportion. So these are challenges that must be addressed from the beginning before anything goes wrong, so that at the end of the day, you know that things are in order. Can I have the next slide, please? So this is a common saying in Nigeria: patient right, and informed consent. Over the years, what I've realized is that a lot of doctors in Nigeria do not know the difference between consent and informed consent. And what happens is that, and why that is so, is that over the years in the past, a lot of patients see doctors, medical practitioners as gods. They go in, I have this, cure me. And I always tell my clients who are majorly healthcare providers that you are not gods. You don't cure, you treat. And most of them are starting to change because of that statement, because a lot of time we forget we are humans. We forget that there are limitations. And what happens is that eventually when they go in, instead of actually getting a full consent, informed consent is simply that you tell the patient that you want to do so, you explain the procedure to the patient. You get the patient to understand the procedure that you have explained in the language the patient will understand. Meaning that if you have an illiterate as a patient, you need to get an interpreter to interpret to the patient what you have just said. And you don't use legal jargons, for instance, to make the patient understand what you have said. You need to make it as basic as possible, so that at the end of the day, the patient really understands what has been said. So we have relevant laws in Nigeria that addresses this. And that, in the National Health Act, Section 20 states that you need to obtain this informed consent. It is different from consent. You can't just say that the patient knows. Did the patient sign that, yes, I consent to this? Did the patient understand the procedure and the options available to him? All these things are very essential and can put the management in jeopardy, And we also have the patient's bill of right. And that has really made it easy for Nigerians to understand their rights when it comes to treatment. Talking about right of information, right of confidentiality. It's becoming really serious, and it's good because it shows progress in Nigeria. And what's the implication of this? Violations can lead to legal action. They can take it up with you. Fines from courts, sanctions from the tribunals of different professional bodies, and even against the facility can even lead to closure, depending on the severity of the situation. So can I have the next slide, please? So human resource management, this is a known fact, especially I'm sure Dr. Osinachi can relate well with this. Brain drain. Brain drain is a serious problem in Nigeria, and it's a serious concern, not just for the practitioners or professionals, but even for healthcare managers. Today someone has jackpot to another country and happens to be the lead surgeon or the lead doctor. What do you do? And there's a patient coming in the next week. How do you cover for the shortages? This is a serious challenge, and most of the time, it's either they refer the patient or, they have to just look for a solution that they don't even like, go for a choice that is not even favorable. but it's a challenge, So yes, the regulation cannot hold. You can, at the end of the day, nobody is banned. I know that recently the National Assembly wanted to pass a law that you have to practice for so years in Nigeria before you can leave the country. That is a draconian law. It will not pass anywhere, unfortunately. So it's a serious challenge. And yes, we have the Labor Act. It's not really up to, not really functioning. I know if I say it's functioning, in fact, a lot of people might unmute themselves and say no to me. We all know the facts. So the Labor Act is not functioning in Nigeria, unfortunately, and these are things that we need to really walk the talk. We need to walk the talk. And it's unfortunate because if we don't do this, people will keep leaving the country to better climes. And what's the implication? Poor workforce management can lead to low morale, strike here and there. Recently, I know that the NJC, Nigeria Labour, NLC rather, planning to go on another strike. Unfortunately, and this, unfortunately really affects everything. Suboptimal patient care as well. It's another issue. And how far can we go with this? How far, even as a country, it's a big issue. And so these are challenges that the healthcare managers face. It's a legal, they are constrained basically with working with what is available as well. And still have to go for those who are qualified and have the required skill and license. So they're limited in that way, and something needs to be done, but not the draconian law that the National Assembly is proposing recently or has proposed recently. I don't think that will fly anywhere. Can I have the next slide, please? So this, I know Dr. Osinachi touched on this. It's a legal issue. And in fact, people are becoming more aware of this. They are really becoming more aware. It is non-negotiable, especially in this digital world that we are now, that, before you know it, camera. I can remember a case many years ago that my then boss handled. And it had to do with a patient who had a popular man like that in Nigeria. And the nurse brought out her phone and snapped the patient and posted it on social media. And it was very easy to, take the case up against the hospital. So the hospital got millions of naira because of that. So it's a big deal now, and it's even people are becoming more aware of this. So we have the National Health Act, Section 23, that covers that as well. Confidentiality is non-negotiable. It's not negotiable. And we also have the Nigeria Data Protection Regulation 2019, that provides for guidelines when it comes to safeguarding patients' data. I know a lot of people always like to talk about, data is the new oil. It's more than that. And we have to be very careful, especially healthcare managers, when trying to structure how to protect, medical records, and how to train the hospital staff as well. And our hospital staff, most of the time, we always think of only the professionals, but it includes even the cleaners, the drivers, because you don't know someone will drive the ambulance, and that person is not likely to be a medical professional. So we must really try and expand the scope to cover every corner to ensure that nothing leaks. It's very critical. So what's the implication? Breaches of confidentiality can result in legal action and loss of trust. If they know that your hospital is not really big on privacy, to be hard for you to get good clients, good patients come in, and because there's lack of trust. Nobody wants their private life out there, especially when they are sick. So it's a big deal. Can you go to the next slide, please? So ethical and legal dilemma. There's a little lot in this area, and if you check the medical law websites and platforms, we have a lot on this, a lot that you can benefit from. And but I will just talk a little bit on what I have here. But there's a lot on this. It's a big challenge in Nigeria, especially for healthcare providers. For instance, I've had clients call me and say, what is the position on euthanasia in Nigeria? If a patient wishes to die, euthanasia is simply mercy killing. Like maybe the pain is too much. Can you, as a physician, as a medical doctor, assist the person in dying? I know that we've had a lot of theses on right to die in Nigeria, but we still don't have solid laws till now. As far as I'm concerned, it is still illegal. It is still to be considered as murder. And maybe in the future there might be other, there might be exceptions to that. But right now, it's difficult, it's an ethical issue. Because as a doctor, you don't want to see your patient in pain for years. And you know that, the only palliative measures you can do at best. A lot of developed countries already have laws on euthanasia. And, Nigeria is a religious country. So it's really going to be hard for us to have such conversation, you know, um, established and, getting to a conclusion that everybody agrees with. Also, the resource allocation, I talked about brain drain earlier. See a problem. Brain drain means that now we have limited doctors, limited resources. How do we allocate it? How do we prioritize the right persons? How do we ensure that not only the rich get to enjoy the health facilities because they can pay more? It's a serious challenge. Unfortunately, SK managers still need to think of the profit side, especially if it is a private institution. So how do we ensure that all these issues are resolved and we prioritize every patient, all patients at all times? So we have the law, the National Health Act, that talks about also research, healthcare research, how far can you go? Connecting it also with the informed consent. Consent is required in everything. When you want to bring someone in and you want to use them for research, what is the procedure? All can be found in the National Health Act, Section 33, that addresses this issue of what should you do? How should you go about it? But informed consent is at the center of everything. If a patient says, I want to know what you want to do to my body, and I want it in the language I understand before I can give an informed decision. You cannot say, no, you don't bother. It's a standard. We also have the Code of Medical Ethics in Nigeria that provide for ethical guidelines for medical practitioners. Very key on that. So if you want to learn more about this, we encourage you to check our platforms, our websites, social media platform. There's a lot on. We had a series on ethical dilemmas. There's so much to gain from it that comes with like questions and answers. So what's the implication? Ethical violations can lead to disciplinary actions and legal consequences. Usually when it is plainly, purely ethical issue, it's usually addressed by the disciplinary bodies, the professional bodies and the disciplinary units, like the tribunals. Can I have the next slide? I'm just trying to, push so that can have time for question and answer. I'm sure people might have questions for Dr. Osinachi as well, so that we can take it all together. And I think moving well fast. So what are the recommendations? What can we do? So first is we need to strengthen the compliance. If I were to be an healthcare manager, first thing I want to look at is, to review and update policies of the company, of the healthcare institution, of the hospital to ensure compliance with regulations. The regulations in this regard simply means laws, policies, guidelines that applies to what I'm managing as an healthcare manager. Also, training and education. I spoke about even the driver, the ambulance driver needs to be educated. If they don't know, there's no way they can be conscious of these things as well. So if you have not trained them, they wouldn't know. So we need to ensure that they are well educated, they are well trained, and it has to be continuous on legal and ethical standards. Also, risk management. There must be a robust risk management strategies to mitigate legal challenges. Because what I have found out, for instance, in Nigeria, one of my presentations, I remember saying something about in Nigeria, you can't if you have an hospital and you have a, let's say, emergency section, and they bring in an emergency patient, you can't reject. The least you can do is to stabilize and refer, or do your best and show that you've done your best and refer. Once there is like emergency section in your institution, a health institution. So if there is no risk, proper, robust, good enough risk management strategies in place, it will be hard. So healthcare managers need to understand this and put in place the right strategies to mitigate legal challenges that can come from these things. Then patient-centered care. I've been emphasizing on informed consent. That is center now. If a patient, even if it is medical advice, or what do I put it? If it is something, you're a doctor and you are giving a medical advice to your patient, and that you know that it is life-saving, and the patient says, no, I don't want it. There's nothing you can do. The best you can do is record and say that, you know, the choice that has been made is against medical advice. So as far as that is included there, then you're good. But cannot, because now the world is in a place where it's my body and my right. So even if the decision is made out of ignorance, you are not in the place to say you have to. So all these things will come with the training and the education that has been recommended earlier. And then finally, which is very key, and which is one of the things we do on medical law, is advocacy. You have to advocate for policy reforms to address systemic issues in healthcare management. If the right policies are in place, it makes it easy for healthcare managers. If there are no policies, or the policies are just here and there, it becomes difficult. And this is where I'll be ending today, that right policies help save lives and make it easy for healthcare managers to do their work. And I hope that I have not rushed too much to cover my presentation, and I've been able to pass the message across. So to conclude, when we address the legal challenges, healthcare managers in Nigeria can now improve their service delivery. They can reduce liability, and they can effectively contribute to equitable healthcare system in Nigeria. So thank you very much for listening, and that will be all from my side. So just in case you want to reach out, please, the next slide, please. So just in case you want to reach out to me, that's my email, and you can follow our pages there, but that is pretty much all. Thank you very much.
Thank you so much for that presentation. Very concise and straight to the point. Thank you very much. We do not have time because it's 4:28 and we're supposed to round up by 4:30. So I want to crave everybody's indulgence so that we do not take people's time and we keep them beyond when they're supposed to be here, because everybody has stuff they're doing and they've, budgeted for 4:30. I'm going to be out of here. But we really, really appreciate the people who have turned up for this webinar. And for the people who are unable to join, we're going to upload it on all our social media. You can reach out to the speakers via their LinkedIn, which I believe has been put in the chat box. And you can reach out to MedLaw Hub through our LinkedIn and other channels, which we will put in the chat box. Thank you very much to our speakers for taking time out of their day to be here with us today. It's something that we do not take for granted. It's Thursday, it's a working day, it's either you're just rounding up from work or you're just, you're still in the heat of work. So to take 1 hour, 30 minutes of your time to be here with us today is something that we really, really appreciate. Thank you very much, Dr. Osinachi. And I hope that when we reach out to you in future, because you've given us a lot of ideas and strategies and things that we can do. So maybe and I want to put this out here to everybody here today. If you're thinking about something and you see that there's an eye there out of the numerous that the good doctor has given us, you see that there's something that you can do, or you're thinking about an idea that you can build up on, I'm giving you the permission. I don't know if I have the right to do that, but I'm giving you the permission to reach out to Dr. Osinachi via LinkedIn to ask for some advice or some guidance or some encouragement or whatever the case may be. I don't know if I have permission to do that or I have the right to do that, but I'm
Yeah,
doing it.
please.
But
Yes, go ahead.
thank you.
I'm
Thank
available.
you. Oh, thank you. Thank you so much, Doctor, for being here with us today. And we really appreciate your time. We've learned, I have personally learned a lot, and it's, making me think in a different direction. I'm sure that that's the same for every other person here. It's making us think in a different direction. Thank you very much. And thank you, Mr. Adeoye, for, also taking time out of, because I insisted you have to be here. Who will talk about the legal challenges? So thank you very much for taking time out of your day to be here with us to talk about these things. We really, really appreciate it. And I hope that we can reach out to you in future and you will answer us and you will, come back to us when we call you. Thank you very much. And thank you to everybody here. If you have any questions, you can reach out to Medlaw Hub, or you reach out to the respective speakers. And I know I've said thank you a lot, but yeah, so this will be the end of it. Thank you for joining us, and check our social media to, listen to this webinar again, because it's something that we constantly need to remind ourselves about. We need to remind ourselves about the things that have been shared here. So you can always go back to our social media platform, YouTube platform, to listen to this webinar again. Thank you very much, everybody. And until our next webinar, see you soon. Thank you.
Thank you, Frida.